Hello and welcome to our channel. In this video, we will discuss about a very important topic, that is heart attack. And the topic which we will cover in this video are: what is the basic meaning of heart attack? What are the warning signs for heart attack? What are the clinical features, that is, what are the signs and symptoms? What are the risk factors? What is the basic etiology, that is, what are the causing factors for heart attack? And what are the investigations? What is the diagnosis? And the very important part, that is the management part. So these are the basic topics which we will cover in this video. So let's start about today's topic with the definition, that what is the exact meaning of heart attack. So, during a heart attack, the blood supply that normally nourishes the heart with oxygen is cut off, and the heart muscles begins to die. So, this is the exact meaning of heart attack. And heart attacks are also called as myocardial infarctions. Now, next we will discuss about what are the warning signs for heart attack, which is very important to know. So, some peoples who are having a heart attack have warning signs, while others shows no signs. And some symptoms that may people report are chest pain, upper body pain, sweating, nausea, fatigue, vomiting, trouble in breathing, that is dyspnea or breathlessness, you can say. And the heart attack is a serious medical emergency. Seek immediate. Now, one by one, we will discuss about the various warning signs of heart attack. So, first sign. So, let's talk about it. So, most people with heart attack experience some sort of chest pain or discomfort. But it's important to understand that chest pain doesn't occur in every heart attack. And chest pain is a common sign of heart attack. People have described this sensation as feeling like an elephant is standing on their chest. Some people doesn't describe chest pain as pain at all. Instead, they may say that they felt chest tightness or squeezing. Sometimes this discomfort can seem bad for a few minutes and then go away. Sometimes the discomfort comes back hours or even a day later. These could all be the signs your heart muscles isn't getting enough oxygen, which is called hypoxia. Pain and tightness can also radiate in other areas of the body, and the most people associate a heart attack with pain working its way down the left arm. That can happen, but pain can also appear in other locations, including upper abdomen, shoulder, back, neck and throat, teeth and the jaws. So this was the first warning sign for heart attack. Now, next we will discuss about the second warning sign, that is sweating day and night. So let's talk about it. So, sweating more than usual, especially if you are not exercising or being active, could be an early warning sign of heart problems. Pumping blood through clogged arteries takes more effort from your heart, so your body sweats and more to try to keep your body temperature down during the extra exertions. If you experience cold sweats or clammy skin, then you should consult your doctor. Night sweats are also a common symptom for women experiencing heart troubles. Women may mistake this symptom for an effect of menopause. However, if you wake up and your sheets are soaked or you cannot sleep due to your sweating, this could be a sign of a heart attack, especially in women. So this was all about the second warning sign for heart attack. Now next, the third sign for heart attack is fatigue. So let's talk about it. So Fatigue can be less commonly recognized heart attack sign in women. According to American Heart Association, some women may even think their heart attack symptoms are like flu-like symptoms. Fatigue and shortness of breath, that is called dyspnea, are more common in women than men and may begin months before a heart attack. That's why it's important to see a doctor as early as possible when you experience early signs of fatigue. So this was all about the third warning sign of heart attack. Now the fourth sign of heart attack, that is lightheadedness. So let's talk about it. So lightheadedness and the dizziness can occur with a heart attack and are often symptoms women describe. Some women report they feel like they might pass out if they try to stand up or overexert themselves. This sensation is certainly not a normal feeling and shouldn't be ignored if you experience it. Now the next warning sign for heart attack is heart palpitations. So let's talk about it. Heart palpitations can range from feeling like your heart is skipping a beat, to having changes in heart rhythms that can feel like your heart is pounding or throbbing. Your heart and body rely on a consistent, steady beat to best move blood throughout your body. If the beat gets out of rhythm, this could be a sign you are having a heart attack. Now the next warning sign for heart attack, that is indigestion, nausea and vomiting. So let's talk about it. So often people begin experiencing mild indigestion and other gastrointestinal problems before a heart attack. Because heart attacks usually occurs in older people who typically have more indigestion problems. These symptoms can get dismissed as heartburns or another food-related complications. So now the next. So these are the various warning signs for heart attack which you should note, which you should observe in your body if you are suffering from this problem. And you shouldn't experience such symptoms, such problems, such warning signs. So this was all about the warning signs of heart attack. Now next, risk factors. So what are the risk factors for heart attack we will talk about? So a number of factors can put you at a risk of heart attack. Some factors you cannot change, such as age and family history. Other factors called modifiable risk factors are one you can change. So the risk factor that you cannot change include age. If you are over age 65, your risk of having a heart attack is greater. Second, sex. Gender. Male are more at risk of heart attack than women. Third, family history. If you have a family history of heart disease, high blood pressure, obesity or diabetes, you are more at risk. Fourth, race. People of African risk factors which you can change. So they are smoking, high cholesterol level in your body, obesity, lack of exercise, diet and alcohol consumption, and stress. So these are the various risk factors for heart attacks. Now next we will discuss about the basic etiology for heart attack. What are the causes for heart attack? So there are few cardiac conditions that can cause heart attacks. One of the most common causes is plaque buildup in the arteries, which is called as atherosclerosis, which prevents blood from getting to the heart muscles. And heart attacks can also be caused by blood clots or torn blood vessels. And less commonly, a heart attack is caused by a blood vessel spasm. So this was all about the etiology. Now next we will discuss about the clinical features, that what are the signs and symptoms of heart attack which you may observe. So symptoms for heart attacks include: first, chest pain or discomfort; second, nausea and vomiting; third, sweating; lightheadedness or dizziness; and the next, fatigue. So these are the signs and symptoms which you can experience if you have heart attack. So this was all about the clinical features. Now next we will discuss about the investigations. Now next we will discuss about the diagnosis part, that how one can know whether they are having heart attack or not. So investigations for heart attack. A diagnosis of heart attack is made by a doctor after they perform a physical examination and review your medical history. Your doctor will likely conduct an ECG, that is electrocardiogram, to monitor your heart's electrical activities. Let's talk about ECG. So, electrocardiogram. This first test done to diagnose a heart attack record electrical signals as they travel through your heart. Sticky patches, electrodes, are attached to your chest and limbs. Signals are recording as waves displayed on a monitor or printed on paper. Because injured heart muscles doesn't conduct electrical impulses normally, the ECG may shows that a heart attack has occurred or is in progress. So this is the first investigation. Now second, blood tests. So certain heart proteins slowly leak into your blood after heart damage from a heart attack. Emergency room doctors will take samples of your blood to check for these proteins or enzymes. So this was all about the second investigation for heart attack. Now some additional tests are: if you have or had or having a heart attack, doctors will take immediate steps to treat your condition. You might also have these additional tests, like first, chest X-ray. An X-ray image of your chest allows your doctor to check the size of your heart and its blood vessels and to look for fluid in your lungs. Second additional test, echocardiogram. So now let's talk about it. Sound waves, that is ultrasound, create images of the moving heart. Your doctor can use this test to see how your heart chambers and the valves are pumping blood through your heart. An echocardiogram can help identify whether an area of your heart has been damaged or not. Now the third additional test, coronary catheterization, that is angiogram. Let's talk about it. A liquid dye is injected into the arteries of your heart through a long, thin tube which is called catheter that's fed through an artery, usually in your leg or groin region, to the arteries in your heart. The dye makes the arteries visible on X-ray, revealing areas of the blockage. Now the last additional test for heart attack is cardiac CT scan or MRI. So these tests create images of your heart and chest. Cardiac CT scans use X-rays. Cardiac MRI uses a magnetic field and radio waves to create images of your heart. For both tests, you lie on a table that slides inside a tube, problem or not. So this was all about the investigations. Now last, which is a very important part, that is the management. Very essential part of every disease, that is management, how to manage. So let's talk about it. So a healthy diet and a lifestyle are essential to maintaining a healthy heart. as we all know that. Alternative treatments and lifestyle changes can improve your heart health and reduce your risk of a heart attack. But it's important to ensure that lifestyle changes don't interfere with the medications you may be taking. So always consult your doctor before trying an alternative treatment. So the first management here is nutritional therapy. So let's talk about it. So as we all know that a healthy diet is very much necessary. It is very important aspect of heart health and is crucial in preventing CAD, that is coronary artery disease, and heart attacks. In general, maintaining a healthy diet rich in fruits, vegetables, whole grains, and leaf proteins is an effective way to maintain a healthy heart. Stay away from processed food and those that are high in fat and sugars. The American Heart Association, that is AHA, recommends eating omega-3 fatty acids at least twice a week. This type of fat can reduce the risk of heart disease. These fats are found in cold water fish like salmon, herring, and sardines. Second, regular exercises. As everyone is very much familiar with this term, that is exercise. So everybody knows for 30 minutes, 5 times a week can make a noticeable difference. Talk to your doctor before starting an exercise program. If you have had a heart attack, you want to be sure your heart is ready for exercise. Thirdly, meditation. Recent studies have shown that daily meditation can reduce stress and lower blood pressure, which are risk factors for CAD and heart attacks. There are many forms of meditations, including guided meditation, mantra meditation, mindfulness meditation, yoga, tai chi, pranayams. So these are the various forms of meditations which you can perform. And any of these can be beneficial for you. It is also not necessary to follow any particular form of meditation. You might just sit comfortably, close your eyes, and repeat a phrase for about 20 minutes. The idea is to quiet your mind and to let your mind and body connect and relax. Now the next, that is quit smoking. If you are a daily smoker, chain smoker, or any kind of smoker, so please quit smoking. It is very much injurious for health. Everybody is very much concerned with this term. So quit smoking. If you smoke, you may have considered quitting it in the past, but doing so is even more crucial after a heart attack. Smoking is a risk factor for heart disease because it increases your blood pressure and risk for clot by reducing oxygen cells within the bloodstream. This means that your heart works harder to pump blood and has fewer healthy oxygen cells to maintain optimal performance. Quitting smoking now can significantly improve your overall health and also help reduce the occurrence of future heart attacks. Be sure to avoid second-hand smoke too, as it possesses similar dangers in terms of attack. So, give your heart a chance to heal after a heart attack. This means you may need to modify your normal outline, routine, and reconsider certain activities for several weeks. Gradually, ease back into your everyday routine so you doesn't risk a relapse. You may have to modify your daily activities if they are stressful. It may take up 3 months before your doctor gives you the okay to go back to work. Depending on stress levels of your job, you may need to significantly cut back on your workload and ease back into on a part-time basis. You may not be able to drive a vehicle for at least a week after your heart attack. These restrictions may be longer if you have any complication. Each state has different laws, but the general rule is that your condition must be stable for at least 3 weeks. Trust resources before you are allowed to drive again. Your doctor will likely advise you to hold off on sex and other physical activities for at least 2 or 3 weeks after your heart attack. Now next, when to seek medical attention. So, if you are at an increased risk of having another heart attack after you recover from your first one, and it's vital that you stay in tune with your body and report any symptoms to your doctor immediately, even if they only seem slight. Call 911 or seek emergency medical attention if you experience sudden and extreme fatigue, second, chest pain, pain that travels to one of or both arms, third, rapid heartbeat, fourth, sweatiness or without exercising, and the last one, that is dizziness and the faintness or lightheadedness, next leg swelling, next shortness of the breath, that is dyspnea, if you are having some difficulty in respiration. So immediately call at 911 to seek emergency medical attention if you are experiencing such symptoms. Now let's talk about the diet. A low-fat, low-calorie diet has been proven to help prevent the risk of heart attack. However, if you have already had a heart attack, eating right is simply a must-be to help prevent future occurrences. One helpful eating plan is called the dietary approaches to stop hypertension or DASH. The overall goal of the diet is to limit sodium, red meat, and saturated fats, while focusing on potassium-rich sources of fruits and vegetables, along with lean meats, fish, or plant oils. The Mediterranean diet is similar to DASH in that they both emphasize plant-based food. Some researches have suggested that a plant-based diet may decrease inflammation and oxidative stress, which contributes to heart failure. Such diet may also decrease heart disease severity. So avoid trans fats and saturated fats whenever possible, because these fats directly contribute to plaque formation in the arteries, that is atherosclerosis, and when your arteries become clogged, blood can no longer flow to your heart, resulting in heart attack. Instead, eat fats that comes from plant sources such as olive oil or nuts. Next, eat fewer calories. Eating too much calories and having overweight can also strain your heart. Managing your weight and eating a balance of plant foods, lean meats, and low-fat dairy products can help. Third, limit sodium. Reducing your daily sodium intake to under 2,300 mg trusted source per day can decrease blood pressure and the overall strain on your heart. This is also a key element of DASH diet. Next, focus on eating produce. Whole, fresh fruits, vegetables should be staples in your diet. When fresh produce isn't available, consider substituting with no sugar added, frozen, or salt-free canned versions. So we have discussed about heart attack, what are the warning signs of heart attack, and we have discussed about what are the clinical features, that what are the signs and symptoms, what are the risk factors, what are the causes, and what are the investigations for heart attack. And the very important, we have discussed about the management part, and also we have discussed about the diet plan. So that's all. That's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Stay safe, stay healthy, stay tension free, and Don't forget to perform exercises, meditations, yogas, and pranayams daily, at least for 3 hours. That's all. And yes, thanks for watching our video.